Thank you for joining us for another edition of the Beyond the Blade podcast. I'm Dr. Zurarian from Zuri Plastic Surgery, and we want to talk today specifically about labiaplasty. This is a very hot topic in plastic surgery, and I want to break it down for you in a very simple way so that everyone can really understand what is a labiaplasty, why do we bother doing it, why are patients looking to have this surgery so often in our practice in plastic surgery, and what are the aspects of a labiaplasty that you should consider regarding outcomes and improving the overall female genital area. So a labiaplasty is basically a removal or a reduction, rather, of the extra labia minora tissue in the vaginal area. And we see this phenomenon among women at many different ages. So this is not something that we see in isolation in older women or in post-pregnancy women. It happens to all women. And this is just a genetic factor here that just like some women develop very large breasts as they age or through puberty, the labia tissue can expand or stretch over time, related a lot to some hormonal changes that occur throughout a woman's life. So when we talk about labiaplasty, what we're talking about is a very simple surgery where we trim or wedge, which are the two techniques, the extra labia minora skin. And the reason we want to do that is because very, very many women have concerns about the pulling, the tugging, the uncomfortable sensations of this extra labia minora tissue. Some of them feel ashamed. Some of them feel very self-conscious at the moment of intimacy. And so extra labia minora tissue is something that we can very easily remove and give women a lot of empowerment about how they feel regarding the genital area. Now, the surgery can be done in many different ways regarding anesthesia. And so my job as a plastic surgeon is to help you feel comfortable during the operation. For me, that's extremely important. And we want our patients to be able to relax and not to have concerns about pain. So if you're maybe on a budget and you want to have a labiaplasty, but you don't want to pay for the extra anesthesia fees, it can be done under local anesthesia. We typically give our patients some Valium, which is basically an anti-anxiety medication, a relaxation oral medication, and then we proceed with the surgery under local anesthesia. Now, local anesthesia is not exactly pain-free because you have to feel the injection of the anesthesia, and that can be a little bit uncomfortable, can cause some burning in the area while the anesthetic is being injected. But it's very doable, and many of our patients go that route. Now, if you're the type of person that doesn't want to hear anything, see anything, feel anything, there are a couple of options for you, which is sedation, where we place an IV in your arm and we give you some medications to help you relax. You basically doze off. You don't feel anything. You don't feel the injections of the anesthesia. And when we're done, we simply wake you up. We let the medications wear off, and we take care of you in the post-anesthesia care unit. That's one option. And the third option is a full general anesthetic, which is very, very rarely ever done with labiaplasty unless we're doing it in combination with other surgeries. And it can be done in combination with other simple operations like liposuction or breast augmentation, eyelid surgery, for example. We can combine that with labiaplasty. What we do not want to combine with labiaplasty is especially two operations. Number one, tummy tuck. The inflammation and the swelling after an abdominoplasty can go down into the pelvic region and can cause us some problems with our labiaplasty wound healing. Also, thigh lifts. Not a good idea to combine a thigh lift with a labiaplasty at the same time, again, due to the swelling that can occur in the thigh region, which can be transmitted into the genital region as well. So those are two very important things to consider. When we talk about labiaplasty, we also need to talk about the different components of the female anatomy. So if we work from the top to the bottom, we have to consider the clitoral hood. The clitoral hood is very important because there are many women that have a lot of difficulty with sexual stimulation. They have basically no stimulation because all of the excess clitoral hood skin is covering everything and making it very redundant. So the clitoral hood skin removal is a very, very good idea for those types of women that have that kind of skin excess in that location. It can be done at the same time as the labiaplasty, removing the labia minora tissue. And then we talk about the perineal area. The perineal area is the gap or the space between the vaginal entrance or the canal and the anal entrance. So in that location, a lot of women have redundant or extra skin. Some of them call it a skin tag. Some of them have had a lot of birth trauma in that location, episiotomies, for example, which is basically the gynecologist having to cut the canal to widen it to allow the baby to be born. So this is a very delicate area, and we have to treat it as a separate location. It can be combined with labiaplasty. The last component that I think a lot of people miss when it comes to labiaplasty is the labia majora. The labia majora is a very important component to the overall aesthetic and also the function of the female genitalia. Now, the labia majora over time, especially in our menopause years and after having children, can become very flat. We call that in medicine atrophy or atrophic. A lot of that is just hormonal changes that can occur. And if there's a lot of deflation of the labia majora outside of the labia minora, that can cause us some problems because it will cause the labia minora to protrude. Visually, it'll make it look like it's much more out there. If we add a little bit of your own body fat using nano-fat grafting principles, and we've talked about on this podcast the LipoCube system with Dr. Cohen, which you can watch that podcast as well, it's important to rejuvenate the labia majora. The labia majora should have at least some volume. It shouldn't be completely flat, and it also shouldn't be completely overdone. So we have to find a nice aesthetic balance between labia majora volume, labia minora skin excess removal. We have to work on the clitoral hood, and we also have to work on the perineal area. So we have to look at everything very holistically to give our patients the best functional and also cosmetic result. Now, please note that I have not touched upon the vaginal canal itself. We do have a lot of questions about, can we do vaginal tightening during these types of surgeries? Now, what I recommend as a less invasive approach to vaginal canal tightening through surgery, I recommend the use of the device called Empower. Empower is a fantastic device that uses radio frequency energy to basically cause tightening of the vaginal canal. It stimulates the mucosa, which is the lining of the vaginal canal, to reproduce itself and to give you much better overall tightening and re-epithelialize or allow new cells to come in to that area and help a lot with conditions such as lichen planus, vaginal dryness, sometimes what we call dyspareunia or pain during intercourse. These are all aspects that can affect women at different ages, can affect women after they've had children, and most especially can affect women who are in their menopause or perimenopause years. So if you're thinking about completing the entire vaginal rejuvenation process, you want to consider the clitoral hood, you want to consider the labia minora, labia majora, extra perineal skin, and you want to consider vaginal tightening or vaginal rejuvenation as part of that. If you're interested in the Empower device, we offer that at our hydrology wellness location here in Coral Gables in Miami, and we can help you navigate that process. It's actually very comfortable. It's not painful at all. We use a very special probe that is your probe that you can bring back with you every time you have one of your sessions. And we typically do these sessions at a 1 a month interval to help our patients regain a lot of pelvic floor strength, which is a big issue for women who've had children, who've had episiotomies, or have had very large babies. The pelvic floor becomes very weak, and this causes a lot of other problems for women. And so we want to be able to offer our patients a complete and total, not only surgical rejuvenation, but also functional as well. And so you'll hear me talk a lot about that on the Beyond the Blade podcast. You'll hear me mention the importance of not only the beauty part, the aesthetic part, but also the functional part. If we can bring those two aspects into one, that's where we're going to provide our patients with maximum benefits, maximum results. So I want to thank you for listening to another edition of the Beyond the Blade podcast. This one was dedicated to labiaplasty, but we'll be bringing you many more podcasts on very interesting topics. See you soon.